Hi again, guys. So with this video, this is not about hair. This is about my pregnancy. I just wanted to cover that a little bit. Um, I'm 38 weeks, or almost 38 weeks pregnant. I'm actually 37 and 6 days now. Um, I'm due May 17th, 2012. Right now it is May 1st. So, yeah, I know it's really late to be starting a pregnancy vlog, um, but I'll cover, you know, everything that happened at the beginning of the pregnancy, and this has definitely not been an easy pregnancy, so I'll talk to you about all that. Hopefully I can be of some help to some people. So right now I'm just going to do a 38-week pregnancy vlog. So my symptoms this week have not been awful. I've actually been feeling pretty decent. I can't sleep. It's actually 4:20 in the morning right now. I just can't get comfortable. Heartburn in the past few days has been pretty bad. A recurrence of nausea. I would assume it's just because the baby is so big, and a lot of indigestion, which I currently have now. So, I haven't noticed much of a decrease in movement from her. By the way, I'm having a girl. Her name is Alina Marie. But I haven't noticed much of a decrease in movement. Just a slight bit. But I know that the baby's running out of room in there, so I'm not worried about it. I hurt. I feel like I've gotten hit by a car. It's really bad. It's like the flu when your body hurts. My feet are the worst. My back, my hip is. I actually talked to my doctor about it today, and she tried to tell me to go to a chiropractor. It's something called like popping hip syndrome. I mean, it literally feels like your hip is going to dislocate. And it's getting worse, the bigger the baby gets, putting pressure on my hip and everything. It's mostly on the right side, but when you bend over or relax or lay down or anything, it feels like your hip is just going to pop out. I've been trying to jumpstart labor to no avail. I'm about 2 centimeters dilated. I'm 75% effaced, where I was 2 weeks ago. I've had prodromal labor, which is where labor starts and stops, and it's so annoying. It's just been back labor, because I want it, if it's going to start, I just want it to start. I don't want it to stop. But I have a breast pump. I've been using that to start contractions. I mean, after like an hour, I'll have 3 or 4 strong contractions, and then as soon as I stop pumping, they stop. And by then, I'm sore to the point where I have to stop pumping. I do want to breastfeed. I want, what's best for my baby, and I'll cover all of that in another video. But I feel like, obviously formula is not much of a substitute for breast milk, so, for the real thing. So, What else? I have noticed a decrease in my appetite. I'm not sure if that's related to the indigestion and the heartburn, or if it's just a late pregnancy thing. But yeah, I've definitely not been wanting to eat quite as much. I'm up to 143. I know that may not sound like a lot to other pregnant women. Like I said, I'll go over all of that in another video. But it's actually a 33-pound increase for me, or 34-pound increase for me. So right on track, you know, for the weight gain that you're supposed to have during pregnancy. What else? I've noticed that she's dropped this week. I actually started feeling extremely nauseous, and my insides kind of hurt, and I noticed that my stomach looked different, and noticed that she had dropped. So every time she changes position, it makes me feel like really sick for a few hours until I get used to it. So hopefully it won't be long. My doctor kind of freaked out. She was the one that told me to use the pump to induce labor, you know, after 34 weeks. And I waited until 37 weeks whenever I was full term, you know, to even try anything to induce labor. And she freaked out on me today about using the pump. I go back Wednesday for an ultrasound and another doctor's appointment. I was informed today that I may not be able to get an epidural because my blood pressure, I'm hypotensive, which means that my blood pressure is very low. And I don't know if you know, an epidural actually drops your blood pressure pretty dramatically. So with mine already being very low, mine's normally 80s over 50s, something like that, 30s. She told me that if it does not go up from the pain, she said she's foreseeing it to go up, you know, from the pain. If it does not, for some reason, I will not be able to get an epidural. And I can't handle narcotic pain medication. I just can't tolerate it, so we're looking at a natural birth. Yeah. So I won't know until I go into the hospital in labor whether or not I'll be able to get the epidural or not. She's already engaged. She's 0 station, +1 station, something like that. She's down there. But yeah, I'll do a quick belly shot, and I'll come back later and I'll talk about the problems that I've had during the pregnancy. I think they're probably pretty unique, you know, to me. I don't think this generally happens to people. But yeah, I'll go ahead and give you a quick belly shot. No stretch marks. I have one. It's kind of like an X. And that's it. Use hemp lotion, not cocoa butter, by the way. It's better. I found that it's better. But anyway, before I run out of time. Okay. I don't know if you can see. That's my belly. And that's my little X. But yeah, so I've got 10 seconds left, so I'll talk to you guys later. Bye.